Startup Weekend.
I am a guy who lived in 3 countries, and like wherever it is an international community, just like us now, I feel like it's my home, it's my place, and it has to be in English, and that's our deal now. So, well, I'd say good afternoon, everyone. My name is Mahmoudi. I'm 26 years old. I'm a graduate from School of Engineering. I specialized in biomedical and system engineering. With my brother here, Hamza, he's also an electrical engineer from Navore University in the UK, and afterwards did some professional work just like me. And then we both together now studying the nanoscale science and engineering. So today, what we are going to present to you is our project. It is about having a small, portable, and smart biosensor that is used for detection of several diseases. So our mission is to have a safer and a healthier world. So let's first, before going into details, just go through that scenario. If you can go to the next slide. Yeah, imagine that a lady, she has a problem with health. She goes to the doctor and she did some examination, and the doctor said there, well, you have to go to the lab and then do some blood analysis. And then she goes to the lab and she does the blood analysis, and then they tell her, okay, in order to have the results back, you have to come back in a few days. And then the lady goes in a few days and get the results, go back to the doctor, and then tell her, okay, what to do. So it is a hassle. Our solution is to overcome all of this and have a smarter and faster and cheaper and more sensitive solution. What happens actually in our device is that it is at the size of a cell phone that you can carry in one hand. And what you do actually is just you take the chip outside of the device and you put a blood sample in it. And then you put it back in the device. And then in less than 5 minutes, you get an accurate, sensitive reading for what you wanted to measure in the disease. So our marketing is global and very huge and promising. We are very aware of our target, like the market that we want to target, which is basically the global consumers and especially in the developing countries. So the segmentation would be the pharmaceutical and the practitioners, and also it's going to be. I'm sorry, I got lost in the paper. So, yeah, I mean, it's going to be basically between the global market in terms of the pharmaceutical firms and the practitioners. So our segmentation will be 25 billion per year. So what is the innovation in this? Is compared to the traditional commercialized nowadays product that is either very complex or takes a little time, and on all cases it is requiring a very huge equipment in order to have the reading now. So our plasmonic innovation that we're going to use in our device, it is having the advantage of having a direct and immediate like reading, and it is very sensitive. So our business plan is basically, as you see in this timeline, if we start today, in 6 months we should be able to have the first prototype, and then it's after cooperation with labs and doing some scientific work in this period. And afterwards, like another six months, we'll be able to do the test of this and try to go to the FDA and say, okay, we want to license our product. Afterwards, like maybe a year and a half, we are having our first production, and afterwards we want to make the sales and good plans for accessing the market in all ways, and having like a new applications for our device, and like challenging in all ways all possible chances in the market. And as you see here, if we put a bit of money first, then we get a very high profit. And even if we get only 10% of the potential money that we can get over there, then it is still a lot. So if you can go next. So what we are here in this event, and what we ask you for, what we need for the next step, actually what we are planning to do after it, that we are going to incubators, because we need someone who helps us in many ways, and we find what we need in an incubator. And also we're looking for scientific cooperation for some specific technical reasons that we want to have in the most professional way. So I'm done with the presentation, but before I say thank you, I would like to introduce my team over here. If you guys remember, in the first day, we had some technical problems with the presentation, the freezing thing. So I guess my team will be in the stage, and together we'll try to answer your question in the best way.
Excuse me, I didn't see it. What is the price of the device?
Le prix est composé du prix d'un équipement qui est vendu environ 1 000 €, et ensuite le prix de cartouches rechargeables qui sont vendus suivant les marchés en fonction des coûts de substitution, entre 24 € la plaquette ou bien 8 € pour ceux qui vont en acheter par dizaines de milliers.
How is the competition structured? Who are competitors on the British market?
Nous avons fait une analyse de la compétition, on a trouvé un brevet, l'élément le plus proche c'est un brevet qui a été publié il y a 2 semaines dans la revue Nature, qui est le plus proche. Sinon on a regardé, il existe des compétiteurs, mais aucun n'a la combinaison que nous avons, qui est à la fois le plasmonique, une détection immédiate et une transmission de données sans fil entre le patient et son unité de traitement.
N'avez-vous pas peur qu'avec un prix aussi élevé, les marchés émergents que vous semblez viser soient difficiles à atteindre?
Je pense que les marchés émergents, ce sera la détection avancée d'épidémies, et donc les marchés de volume. Récemment, un industriel américain a signé un contrat avec la Chine et qui a pris un premier lot de 2000 machines pour faire des essais dans une région. Donc je pense que le marché est massif. Donc on aura des coûts de production très faibles, et puis on peut atteindre des coûts de fabrication entre 2 et 3 € la languette, qui va nous laisser des marges significatives dans le produit.
Vous pouvez repréciser ce que vous détectez exactement, parce que ce n'est pas très très clair pour moi. Ce que vous détectez comme problème.
Okay, so if I can answer in English, so basically what we detect is various diseases that is including cancer, for example, like leukemia and others, and viruses. So basically, based on like a well-known thing in biology, which is the binding between the antigen and the antibody. So anything that can be detected through the protein, then you can get it there. And also we have a doctor already in our team, who's like having him. Maybe you can just tell you more about this.
Just very quickly, we are detecting either a protein, it can be a viral protein, viral detection, or a biomarker of a tumor, cancerous biomarker. So we are detecting directly by means of plasmonics the signal of a particle protein by light diffraction.
Juste une question, vous avez envisagé de faire un accessoire pour mobile, ou est-ce que c'est un device?
C'est un device qu'on a. Ça doit être certifié.
C'est un medical device.